Hello everyone. Today we are going to discuss about liver cirrhosis. But before that, we have first to know what is the liver and what does the liver do. Our liver is one of the hardest working organs in our body. It is also one of the largest, located on the right side of our belly just below our diaphragm. Our liver works around the clock to break down nutrients from the food we eat and the substances as your body can use, taking things like fat and proteins to turn them into energy. To help digest fats, our liver produces 1,000 milliliter of bile per day. It also plays a key role in keeping our blood sugar levels constant. If it gets too high, our liver removes some sugar from our blood and stores it as a glycogen. Too low, it breaks down that glycogen to put some sugar back in. But that's not all. Our liver also makes some special proteins so our blood can clot and stockpiles like vitamins and minerals whenever our body needs to boost. On top of that, it detoxifies our system by removing hard substances from our body like alcohol and medication byproducts. Our liver does a lot for us, so we have to take care of it by eating healthy diet, drinking a lots of water, and cutting back on alcohol. Because if not, it may lead to liver cirrhosis. So, what is liver cirrhosis? When cells are injured or damaged and die off, usually that dead tissue that was previously full of living cells becomes fibrotic, meaning it becomes thickened with protein and forms scar tissue. So when our liver constantly forced to process alcohol like in alcoholic liver disease or subject to viral attack for a long period of time like an HPV or anything else that causes a long-term or chronic stage of liver cell or hepatocyte destruction and inflammation, the liver can become seriously scarred and damaged to the point it's no longer reversible, at which point it becomes fibrotic. In the liver, we call this process as cirrhosis. Because it's usually irreversible, cirrhosis is often referred to us as the end stage or the late stage liver damage. When liver cells are injured, they start to come together and form that are called regenerative nodules. You can think of it as the colonies of living liver cells. And these are one of the classic signs of cirrhosis, and why our cirrhotic liver is more bumpy as opposed to a smooth, healthy liver. Also, with cirrhotic liver tissue, you'll see that in between these clumps of cells or nodules are fibrotic tissue and collagen. Here's the classic histology image of cirrhotic tissue. These clumps of cells are regenerative nodules, and the blue stains surrounding are the bands of protein from the process of fibrosis. So how does fibrotic tissue and collagen form? Fibrosis is a process mediated by these special cells, called ciliate cells, that is between the sinusoid and the hepatocyte, known as the perisinusoidal space. In cirrhosis, scar tissue development replaces normal parenchyma and blocks portal flow of blood to organ and affects the normal function. Research shows that the important role of ciliate cells in the development of cirrhosis, which generally stores vitamin A. Fibrosis is initiated by activation of the ciliate cells and Kupffer cells. Damaged hepatocyte and activated platelets are also involved. Hepatic parenchyma damage due to the inflammation activates ciliate cells and increases fibrosis and obstructs the blood flow in the circulation. The formation of fibrous tissue bands separate hepatocyte nodules, which replace the entire liver. Architecture. Chronic injury to the liver results in inflammation, necrosis, and subsequently fibrosis. The risk factors of liver cirrhosis are drinking too much alcohol or severe alcoholism, being overweight, and having viral hepatitis for a long period of time. So let us now discuss the complications of liver cirrhosis. First is portal hypertension. Cirrhosis troubles bloodstream in the liver, creating a high blood pressure upstream. Next is ascites. It's an excess of fluid in the abdomen related to cirrhosis. It can cause abdominal heaviness, difficulty in breathing, and development of hernia. This is the most severe risk, ascites. Jaundice. Cirrhosis damages the liver, which results in accumulation of bilirubin. It comes from degradation of red blood cells. The damaged liver cannot evacuate the excess in bilirubin, causing this yellow coloring. Lastly, hepatic encephalopathy. Severe cirrhosis slows the elimination of toxins by the liver. They accumulated and can lead to neurological disorders like absence, drowsiness, and coma. So, if cirrhosis is left undiagnosed or untreated, it may lead to complications like portal hypertension, ascites, hepatic encephalopathy, and jaundice. Let us now discuss the common signs and symptoms of liver cirrhosis. One of the signs of liver cirrhosis is jaundice or yellowish discoloration of the skin and the eyes, right upper abdominal pain, nausea, fever, fatigue, and loss of appetite. So these are the common signs and symptoms of liver cirrhosis. In conclusion, cirrhosis is a profound architectural modification of the liver due to the accumulation of fibrosis tissue in the entire organ. At an advanced stage, it can be non-reversible and create severe complications. Whatever our age, it is important to have our liver checked. And this is Joma Beth Maninantan, and this is the end of my presentation. Thank you.